Medical Research Validation of the SCIO. Hi, I'm Desiree Dubonnet from the International Medical University, and the SCIO is the most researched energetic medicine device in the history of the world.
I am Paul Drouin, medical doctor from Canada and also professor of integrative medicine at the International Quantum University for Integrative Medicine in Hawaii.
We're going to talk about blood analysis. Here we have a dark field microscope. We're going to be able to look at live blood without having destroying it with high intensity light. We're going to use a diverted light. This is part of the SCIO medical research studies. Paul Drouin would now tell us a little bit more. And here he has done some of the different blood analysis. Now we're looking at just the normal type of red blood cell and the white blood cell under a normal system of dark field analysis. This is in the first part. Now we're going to see soon what happens when he starts turning on the SCIO. We're going to now see that phagocytosis is stimulated. The motility and mobility of the white blood cell is stimulated. And we're going to see that phagocytosis is stimulated as that there is now a more complete red blood and white blood cell activity. This is due to the SCIO subspace stimulation effect. Now we're watching the white blood cell and phagocytosis. Now we're looking at what happens in ZAP mode. In ZAP mode, we're now going to see, now we're looking at what happens in ZAP mode. In ZAP mode, we see that there's even a greater stimulation of the motility and the mobility factors. We're going to see that this white blood cell now is going to be browsing around looking for different types of microorganisms to surround and destroy. The ZAP has actually given it an energy and an increase in mobility and motility factors. Now, Paul and many others have done lots of work with the SCIO, showing that the SCIO works in the stimulation of blood. A host of different things, as we're going to now review more of this. And here we have some of the different blood samples that have been used to give us the studies that have been able to show an increase in motility and mobility factors of the white blood cell in regards to the different types of intruders, the microorganisms. And skin impedance and electroosmosis have been demonstrated that we can provide an electrical stimulation that increases osmosis. This has been well validated. And SCIOs help to boost performance and help to boost testosterone. Here we see some of the pictures from the Chinese Olympic team. SCIO has been helpful in electrohealing, as we've been able to demonstrate in many different research. And the hormone streaming really does work.
How to unleash the infinite possibility of consciousness, but not only that, not only speaking about what is consciousness, but how to relate with it. How we can optimize the power of intention. How we can define the relation between the practitioner, the technology, and consciousness. Are artificial intelligence, computers, software able to give meaning to the process of analyzing data? We will also speak how quantum physics today give the ground to understand the subtle anatomy and subtle body. We will speak also about non-locality or subspace, and how quantum physics define the relation between the healer and the healer, how they entangle together.
As Paul has just told us, there is a quantum consciousness principle. And the little white blood cell, as we can see here, has a consciousness. It has the same DNA as its larger host. But basically, we're going to be able to see now, through the different research that have been done on the SCIO, as now we see how the ZAP mode stimulates the white blood cell to phagocytosis, that bacteria that we just looked at here. There's a direct ability of the SCIO to stimulate these different factors within the blood. As the EPFX has been able to stimulate blood and lymph,
I think quantum physics is proposing, as you know, a new model to relate with reality, with the world. It's a new model that is help us to understand in a deeper manner, not only medicine, but all any field. And this is what is necessary today. Everybody feels that we are in a kind of a transition, mm-hmm. And to do things differently, we need a foundation, and this is what is quantum physics and consciousness.
As we've shown in our different research of the stimulation of mobility and motility factors, neutrophils are able to do this. Here we see healthy blood, round white blood cells flowing freely. No signs of clotting, no signs of bacteria or foreign matter. We don't see any fungus or stress. This is a healthy person's blood. Now we find somebody under nutritional stress. Here we see free radical damage of the red blood cells. We see that there is a congestion, there is restriction, and an impairment of oxygen and nutrient transfer. Free radical damage has hurt these different abilities of the blood to do its job. Now, after using the SCIO, after using free radical fighters, here we see a healthy blood. The blood cell is now round again, and we're seeing a breakup of the conglomeration. Here we have rouleau, where there's a tremendous coin stacking of the red blood cells. This decreases the amount of oxygen transfer and creates poor digestion, edema, and a lack of osmosis. The SCIO can stimulate osmosis, stimulate the red blood cells to break up and to clean the blood. Here we have an extremely rouleau situation where there is an incredible blockage of the oxygen and nutrient transfer. All of the red blood cells are tied together and creating a problem. But that same case now, after 3 days of SCIO work with a little bit of the free radical fighters, and now we see a clean, direct blood. A blood that is now healthy and detoxed. Now there are some undigested fats, little pepper particles floating around. Enzymes will help to diminish them. Here's another sick set of cells that have the free radical damage, chronic fatigue, and other problems, or have hurt this patient's ability to actually work. Now, the same individual, after work on the SCIO, after work on good nutrition, yoga, and exercise, and we see an incredible stimulation of the health of the blood. Red blood cells have been damaged in this case because of toxic waste. Chemical toxicity have created joint pain, leg pain, and many other things, and have put this person out of work. Now, the same person, after having used the subspace treatment, as well as good nutrition and exercise, within 30 days, we see an incredible change. The SCIO is able to put these people back to work and to help their blood get better. We've been able to prove that it can help stimulate detox, stimulate phagocytosis, increase osmosis, and make blood work better. How much better? Well, about 5% better. So sometimes there's even other things to do. But here we have an example of a T-cell helper. This is a cell that is going to now attach itself to a different cell and kill it. This is what happens in cancer. These helper cells are diminished in the AIDS patients. What we've seen here is a demonstration of what happens with the SCIO. Here we see another demonstration of how the SCIO, once turned on, as it turns on about now, and we will see how there's a dramatic increase in the phagocytosis and the motility and mobility of the white blood cell as it now seeks to find the intruder and to surround and destroy that intruder. There's the bacteria as it surrounds and destroys that bacteria. This is the process of bacterial, fungal, and cancer cell done through the T cells. The B cells will work in a different way, but we've been able to show in the research that homeopathy, along with the SCIO, can help this. Cigarettes are one of the worst things that can happen, and this is what happens to the blood when you use cigarettes. It produces aggregation, internal bleeding. It stops oxygen, and it causes rouleau, as we see here, producing even more lack of oxygen transfer. Yeast cells start to build up, and tumor markers. Focal points in the red blood cells. Underlying candida starts to grow, as well as other different fungal structures. Heart congestion because of the inability of the heart to pump this congested blood. And internal bleeding, heart congestion happens as the slow way the person starts to die after too much smoking. And we need to be able to stop the smoking, as well as stimulate the body to be able to break up the rouleau stacking and to get good nutrition flowing. We can see from the different slides, before and after, just how the blood starts to clean up and how the SCIO and a healthy lifestyle help to make the person more healthy, stimulating cleaning up of the blood, helping the body to transfer oxygen, transfer nutrients in a more beneficial, healthy, wellness way. Here we see spicules from liver congestion, rouleau, other factors of unhealthy blood. The white blood cells can be asleep. And then they're not attacking the intruders. As we've shown that there is an energetic electromedicine.
When someone is sick, and the only way that conventional medicine allow that this person can be restored is pharmaceutic and surgery. And it's like saying, you know, the only form of energy on earth is petrol, right? So this will open the door to the expression of all these modalities of healing. I think it's huge, and I think there is no other way to make this happen in our society. It's exciting, and it's not only that, it's needed. Yeah. You know, everywhere. If you look America now, they are questioning the way, you know, if is it private or we socialize some part. And in Canada, it's already done. But the bottom question is not only that, is how you do medicine. Is there another way which is costless? Is it another way that will address the core of the disease? And this is what is quantum medicine. It go at the source. And of course, the consequences are enormous.
The SCIO has been shown to be able to help the body, and it's the most researched energetic medicine device in the world. So I wanted to share this with you, some of the ideas of the medical research validation of the SCIO and blood analysis. This is Desiree Dubonnet, signing off.